Hello, site coordinators of clinical education, clinical instructors, and students. This is Holly Carroll, the Director of Clinical Education at the NAU Phoenix Biomedical Campus.
And Andrea Lerner, the Director of Clinical Education from the NAU Flagstaff Campus.
We wanted to take a few minutes to hear about some exciting news. NAU will no longer be using the Clinical Performance Instrument, or CPI, to evaluate student performance on clinical experiences. This decision came after years of clinician feedback that the tool was too long, too redundant, and difficult to access. Exploring alternatives was needed to address these concerns, but with the understanding that feedback on student performance is essential. After 3 years of investigating what our options were, we have decided to begin using the Clinical Internship Evaluation Tool, or CIET, which was developed by the University of Pittsburgh in 2007. The training and tool completion should take less than 30 minutes, and there is no separate account or password required. All you will need is an emailed personal link. We believe this is the future, and we are excited to introduce this tool to you today. So without further ado, welcome to the Clinical Internship Evaluation Tool, or CIET training, which will give you specific instructions for evaluating our students while on their clinical experiences.
Our objectives for this training are to familiarize all users with the CIET, to make sure all users understand the CIET's definition of a competent clinician, and to clarify how to use the CIET rating scale to effectively evaluate student performance on clinical experiences. The ultimate goal is for every student to get a high 5 on the CIET.
As mentioned already, the measurement of student performance in the clinical learning environment is an essential part of physical therapy education. First, it helps programs adhere to the requirement of CAPTE, our accrediting body, that every student achieves safe and competent entry-level clinical performance by graduation. It also provides a platform for feedback to promote student growth. It allows objectives from both the clinical sites and academic programs to be met. And lastly, it protects the public and the PT profession. The CIET will assess student progress towards competence across 3 10-week terminal clinical experiences, or TCEs. Assessing the completing the CIET is intended to be an efficient and straightforward process for both the clinical instructor and the student. This tool provides a comprehensive approach to student assessment with a dual focus on competence in professional behaviors and patient management skills when compared to a competent clinician. A competent clinician is defined as one that is able to skillfully manage 100% caseload in an efficient manner to achieve effective patient or client outcomes. The expectations for skill and efficiency can be unique to your specific clinic's population and expectations. Each academic program sets their own standards and expectations for student performance. This training will explain how to properly utilize the tool, as well as the expectations for all NAU DPT students. The CIET is made up of 3 sections: professional behaviors, patient management skills, and an overall global rating scale of clinical performance, each of which we will now explain in more detail.
The first section is professional behaviors. This section is broken down into 4 unique categories: safety, professional ethics, initiative, and communication. Each category includes specific skills to assess. Safety includes the ability to maintain safety for self, others, and the patient. Professional ethics includes adherence with ethical and legal standards, as well as rules and regulations, including those for behavior and appearance. Initiative includes the frequency with which the student takes advantage of learning opportunities within the facility and maximizes all opportunities for learning, including accepting feedback, utilizing resources, and demonstrating flexibility. Communication includes both verbal and written skills with patients, families, and other healthcare professionals. Here's what the professional behaviors rating scale looks like for the category of safety. When assessing the student's professional behaviors, the frequency of the appropriate behavior is the objective measure, ranging from always to never. This chart shows NAU's expectations in regards to the frequency of professional behaviors. A rating of never is self-explanatory. Rarely implies the student demonstrates the appropriate behavior less than 25% of the time. Sometimes indicates that the appropriate behavior is demonstrated about half the time. If rating a student never, rarely, or sometimes, please contact the program to discuss your concerns with the DCE. Most of the time refers to the student that demonstrates the appropriate behavior more than 75% of the time. This is our expectation for the end of TCE1 and TCE2. Always is when the student is demonstrating the appropriate behavior more than 95% of the time. This is our expectation for the end of TCE3. The descriptor not observed can only be used when assessing communication skills in which the student has not yet had the opportunity to participate. Each section has a comments box to add more detail. Please always add comments to explain your scores and identify strengths as well as areas for further development.
The second section, patient management skills, looks at the student's ability to effectively manage a patient through each of the components of the patient-client management model as defined by the APTA's Guide to Physical Therapist Practice. Examination includes history, systems review, and tests and measures. Evaluation includes the analysis and synthesis of data, critical thinking, clinical decision-making, and the determination of the patient's impairments or functional limitations. Diagnosis and prognosis includes the determination of the physical therapy diagnosis, as well as the optimal level for improvement through physical therapy intervention, specific goals, plan of care, and criteria for discharge. Intervention includes the student's ability to choose and apply the appropriate treatment, provide patient and family education, monitor responsiveness to treatment, and recognize when discharge is appropriate. Here's a look at the patient management rating scale for the evaluation component. You will be rating the student following your consideration of two criteria: how much support is provided by the clinical instructor, and what types of patients the student is comfortable treating. Student ratings will range from well below to above. This chart on the next few slides shows NAU's expectations in regards to student performance with patient management skills, as well as some important definitions to guide you in the proper use of the tool. Students who are well below require guidance from their CI for all patients. Based on CIET definitions, a student that requires guidance must have the CI present for all evaluation, treatment, and clinical decisions. Students who are below require supervision for all patients or are not efficient in time management for the component of care being assessed. Supervision by CIET definition is when the CI provides verbal cues to facilitate decision-making, corrects minor errors, and monitors for efficiency or effectiveness. Students who are at the level for familiar patients are independently managing familiar patients, yet supervision is still required or significant inefficiencies are present for complex patients. Familiar patients are defined as those without a complex medical history, frequently seen in the clinic, and learned about previously in the classroom. When a student is independent, the CI provides only occasional consultation and clarity for best outcomes. Students who are at that level for all patients are functioning at the level of a competent clinician for the components of care being assessed for all patients, both simple and complex. A complex patient is defined as those rarely seen in the setting with multiple comorbidities and never learned about in the classroom. Lastly, students who are above are functioning at a level exceeding the expectation of a competent clinician for the component of care being assessed with all types of patients. Their clinical skills are evidence-based, highly effective, and they are able to carry a higher than expected caseload. This would be saved for only those students performing beyond the expectations of entry level. It is important to understand that if a student performs at varying levels, you should always default to the lower rating. For example, if a student is considered at that level for familiar patients when working with patients with an orthopedic diagnosis, but would be rated as below when working with patients with neurological diagnoses, you would rate the student at the lower of the two levels and be sure to write comments in the box provided.
Let's take a look at an example. During week 5 of Sally's TCE, she had the opportunity to complete 3 new patient evaluations. 2 of the evaluations were familiar orthopedic diagnosis. Sally was able to make accurate clinical decisions and identify patient limitations with only verbal cues to measure range of motion above and below the affected joint. The third evaluation was a more complex neurological case. During this evaluation, Sally required supervision for all aspects of the evaluation, including identifying limitations and choosing appropriate tested measures to make an accurate clinical decision. Sally was clearly more comfortable during her orthopedic evaluations. How would you rate this student on the CIET patient management evaluation section? This student is performing at the level for familiar patients when it comes to making clinical decisions based on gathered data in the examination, but requires more support with complex patients. The student is making the link between impairments and activity participation, but due to the need of clarification by the CI, the student would be rated at the level for familiar patients for identifying impairments. The student required supervision and verbal cues for identifying all appropriate tests and measures for both familiar and complex patients, and therefore might be rated below. Following the rating of each of the components of the patient management skills section, there is an opportunity to provide summative comments. Please always add comments to explain your scores and identify strengths as well as areas for further development.
The final category of the CIET is the Global Rating Scale. This provides an overall assessment of the student's performance on a level from well below to a competent clinician and above. NAU's expectations in regards to student performance on the Global Rating Scale is explained on this chart. Ratings of 0 to 1 are well below expectations. Students at this level are unable to carry more than 25% caseload and are struggling with safety concerns or red flag behaviors. A rating of 3 is defined as progressing well and carrying 50 to 75% of the caseload. This is the expectation at the end of TCE 1. A rating of 4 is defined as on track and carrying greater than 75% of the caseload. This is the expectation at the end of TCE 2. At the end of the final TCE, it is expected that students receive a high 5 or a rating of 5. This is defined as at the level of a competent clinician and the ability to skillfully manage 100% caseload in an efficient manner to achieve effective patient or client outcomes. When considering caseload, please be mindful that this would be similar to the expectation of a new hire or even of a new grad hire. These expectations are most likely different than those required of the experienced employee. Ratings of 6 through 9 are reserved only for students that demonstrate exceptional performance and maintain a higher than expected caseload while completing tasks beyond an entry-level clinician. A rating of 10 is well above a competent clinician, such as a master clinician or clinical specialist. And finally, at the bottom of this table, you will see the question asking if the student is practicing at a level satisfactory for their current level of education. This provides a final indication of the student's satisfactory performance, given the level of academic preparation using a simple yes/no question. Selecting no on this question alerts the university that the student is not performing at a satisfactory level and should result in your immediate communication with the DCE for further instruction.
We thank you for taking the time to learn more about the CIET. We are excited for this change and want to reiterate that this decision was ultimately made with the busy clinician in mind. We have also created quick guides and reference tools to assist you with your initial completion of the CIET. As with any change, we will be requesting your feedback on the tool and the training in the near future. We hope to hear that it is both time efficient and practical for any student at any level in any setting. Please contact us with any additional questions or concerns. Thank you for your clinical partnership with NAU. Your time, energy, and clinical teaching is paramount to the success of the NAU program of physical therapy.